At some point in your life, you will experience foot pain.
Foot pain is not normal.
Because your feet should not hurt you, ever.
It's really very advantageous if you try to catch foot pain early.
At Carolina Foot Specialist, Dr. Adam Brown and Dr. Andrew Safer see a wide variety of foot conditions.
Well, sometimes we see patients that, for instance, have heel pain.
Heel pain starts in the morning. First step out of bed, you hit the floor, you have usually that sharp pain in the heel, and from there, it can affect the way you walk. You can start to place more pressure on the other foot. You can start to compensate with other muscles around the ankle and in the leg. And then it can lead to all kinds of issues.
There's different forms of heel pain. It can be plantar fasciitis or Achilles tendonitis.
Plantar fasciitis is the most common thing we see in the office. Everybody at one time or another can overstrain the plantar fascia, which is a ligament that sits along the bottom of the foot. It attaches from the heel bone all the way to the toes.
Bunions is a very common condition. Typically it's inherited from your family.
You essentially have a bump on the side of your foot. Many times can be tender in and out of shoes.
We typically see this more in women because of the high heel use that they may have worn in the past. And it can be a very painful condition, especially if you stand up all day in high heels or stand for your job 10 hours a day.
From working all day on your feet to those sassy high heels you wore in your 20s, the experts at Carolina Foot Specialist can help you understand your condition and get you back on your feet.
One of the more common diagnoses we see is flat feet, and I've experienced that myself. And the way that we treat that is with custom foot orthotics here in the office. Other treatments that we see are neuromas, which are inflammations of nerves on the ball of the feet. Over time, especially in women, the fat pad can wear down on the ball of their feet, and a nerve can be inflamed. Another one would be ingrown toenails. We see those not only in children but also in adults, and we have fairly minimally invasive procedures that we can perform in the office to correct those type of problems.
These board-certified podiatric physicians and reconstructive surgeons offer cutting-edge technology.
Here at Carolina Foot Specialists, we have really state-of-the-art technology such as digital x-ray and diagnostic ultrasound. We're actually one of the first podiatry groups to have digital x-ray system for the foot, and it really helps to give a precise, clear image. Basically, we take the x-ray in our x-ray room, it's transferred into a digital image, and we're able to enlarge this image and rotate it. It really has helped to diagnose different forms of stress fractures and heel spurs in the foot.
We have everything we need here in the office to evaluate and diagnose any bony or soft tissue injuries.
As trusted members of the community, both Dr. Brown and Dr. Safer realize the importance of taking care of their neighbors.
Yes, I was born in Charleston, grew up here, went to college in Charleston. I have a family here, a wife and a young daughter named Anna. Played competitive tennis growing up and also high school basketball. And in the recent past, I'm involved with running and also taekwondo.
I grew up here in Charleston, went to Middleton High School, went to college in Charleston, and then did my medical school down in Miami. Came back home, 3 kids later, I have 3 boys. That's it, love Charleston. I played baseball at College Charleston. Following that, I became a runner and trained for a marathon. So it really helps me, connect with the runners and really just athletes that have little things that keep them from participating in their sport or achieving the goals that they want to.
We employ here at Carolina Foot Specialists a conservative treatment plan. We make sure that the patient is very educated on their specific foot condition.
My practice philosophy is that your body is a healing entity. It's always healing. It's my job to make sure that you're healing faster than you're breaking it down.
If conservative treatment does not resolve foot pain, both Dr. Brown and I are board certified in foot surgery.
We like to treat people the way we would our family because we're going to see them around town.
With 2 convenient locations in the Lowcountry, one in West Ashley, the other in Mount Pleasant, Carolina Foot Specialist offers a relaxed and friendly environment. So make your appointment today to see why they are the Lowcountry's foot pain specialists.